Okay, hi everyone. Thank you so much for joining today. I am Heather Foster. I am the Vice President for Marketplace Policy here at ACAP. I want to welcome you to our latest ACAP vendor webinar. This is presented by our strategic ally, Softheon. Softheon has been an excellent friend to ACAP and many of the ACAP plans over the years and really done some tremendous work in the ACA space. So thrilled to have them on board today. We have Kevin Deutsch from the GM and Senior VP of the Health Plan Cloud, too many words there, over at Softheon. And his webinar today is Redefining Success in the ACA Marketplace, Growing Membership, Changing Compliance Requirements, and more. So before I turn over to Kevin, just a couple housekeeping announcements. So this webinar, along with all ACAP calls and webinars, are held in accordance with our antitrust guidelines, of which are available on the ACAP website. We will be recording today's webinar, and we will post the slide deck and the recording on the website by tomorrow morning. And the link will be found in the invitation that was sent you for this webinar as well. So please remember, if your plan is looking for a vendor, do check out the preferred vendor page on our website. And during the call also, please do feel free to ask questions anytime by clicking the Q&A icon at the bottom of your Zoom window and typing in your questions, and then we will go through and answer all questions at the end of the presentation. And so with that, I would like to pass it over to Kevin.
Very good. And thank you, Heather, Ron, Meg, and the rest of the ACAP team for allowing me once again the opportunity to speak with you all today. This has been a tremendous past few months in the ACA, and we're really looking forward to sharing with you some of our experiences and where we see the marketplace going forward. And really, this is a true inflection point for us as we see what has happened with the ACA over the course of the past several years and some of the more recent happenings. And I trust that many of you, if not all of you, have seen the breaking news last week with the Supreme Court once again upholding the ACA by a vote of 7-2. And this is tremendous news as it continues to show that commitment and reinvigoration into the marketplace. And at Softheon, we have been invested in the ACA since day one. It really is incredible how much it's grown over time, with really the ultimate goal of making healthcare affordable, accessible, and plentiful for all Americans. And that truly is our personal mission. And I know that the ACAP plans share that same vision, especially as safety net plans always working in the best interest of your members and your communities. So in today's presentation, we're going to focus on how we redefine success in the marketplace. There is opportunity for growing membership. We're seeing many different compliance changes. We're seeing the overall technology landscape go through a change at this point. And what we're going to talk about today is how do health plans look at that and where do we go from here? And for those of you that are participating in the marketplace today, this content will absolutely be relevant to you. And for those of you that are considering getting into the marketplace, whether you're getting in for this upcoming open enrollment, you just completed your plan filing, or you're planning to get in for open enrollment 2023, I think this webinar will provide you some great insights into some of the things that you should be considering as you look at your ecosystem to support the marketplace. So thank you again to the ACAP team and for those of you that are joining us today, and really look forward to the session. Now, before we look at where we are today, I think it's important that we take a step back. And where I want to flash back to is 2016 and November 9th in particular, because it really was a defining moment. And I recall vividly staying up into the early hours of the morning to see that President Trump was elected. And the next morning, the Softheon leadership team got together and we were sitting around a conference room table, just thinking about, where is the future of our organization going? We were heavily focused in the ACA marketplace. And, there was certainly some doubt about where the ACA was going to be. And we felt that it was strong enough that it would continue to stay around, but we were looking at opportunities within our organization to continue to grow as the circumstances are changing. So this moment really was a defining point. I think we all know, where the story has gone since then. But as we think about that moment around the conference room table, where we really were thinking about how are we going to adapt in these times of uncertainty, I imagine that many of you are now sitting around the conference room table saying, well, the ACA is here to stay. So what are some of the things that we should be looking at and considering as we weigh the option of getting into the ACA? Or for those of you that are participating today, you're thinking about how do we really capture this expected membership growth? How have you been doing that over the past several months with the extended special enrollment period? So you'll see that as times continue to change from where we were under the Obama administration to what had occurred under the Trump administration. And we're actually going to take a look at some of the things that happened under the Trump administration that had actually strengthened the ACA. So ultimately, I point back to this point in time as really an opportunity for us to look at this once again in the bigger picture and figure out where our opportunities may be going forward. So as we look at this concept of president care, if you will, of course, Obamacare was the birth of the ACA. And I'm sure that we all vividly remember some of the challenges with healthcare.gov on day one when the Affordable Care Act was launched in that first open enrollment. And I know that, we were sort of laying the track as the train was coming by to figure out how we were going to navigate this ACA marketplace. And under the Obama administration, we saw a major push through marketing budgets and initiatives to get folks enrolled. We saw extended open enrollment periods and really the goal of covering as many individuals as possible. You saw the beginning of Medicaid expansion. And from there, you also saw some challenges with medical loss ratios, and you saw challenges with members having trouble navigating their healthcare. They haven't done this before. Healthcare really was never a consumer platform. So they were really trying to figure out, what do these plans mean to me? What's covered, what's not covered? So that was where we were under the Obama administration. As I talked about that day in November of 2016, when President Trump got elected, there was some uncertainty of where the ACA would go. We saw the shortened open enrollment window only going to a 45-day period. We saw significant cuts in the marketing budget. We also saw the introduction of ICHRA, or the individual coverage health reimbursement arrangements. And that's allowing the employers a defined contribution for their employees, which we think could absolutely strengthen the ACA. And we'll talk about that a bit more as we navigate here. And then, of course, in Medicaid, you saw the introduction of work requirements. I know I was doing some work in Kentucky under the Kentucky Health Program, and that was a major factor in all that was going on there, which of course then ended up in the courts as well. And then we look at where we are today under President Biden. And over the past 6 months, there have been many things that have occurred to further strengthen the Affordable Care Act, such as the extended special enrollment period, adding an extra 3-month window and then continuing on now through August. You saw the American Rescue Plan Act with the increased subsidies, and you just see continued support from the Biden administration to the Affordable Care Act and strengthening the ability to get individuals covered. So we've had quite a roller coaster ride over the past 8 or so years, and we see that there is plenty still to occur in this journey through the Affordable Care Act. And so to highlight some of the headlines as we really pick apart 2021 here, first and foremost, the extension of the special enrollment period. We had all anticipated this was coming once President Biden was elected, and immediately he had reinstated the open enrollment period, calling it a special enrollment period from February 15th to May 15th. From there, we had the American Rescue Plan Act, and a lot of the American Rescue Plan Act was focused in healthcare. offering increased subsidies to individuals, making changes to the structure of COBRA, and other things related to the Affordable Care Act. So right away, you see that continued commitment from the administration. The 3-month window wasn't enough. It was extended out to August 15th. And what we saw was many of the state-based exchanges as well had adopted this policy of extending the special enrollment period. And then lastly, as of a few weeks ago, we have officially surpassed 1 million new enrollees into the ACA Marketplace as a result of the special enrollment period, as well as those increased subsidies. So we're seeing that commitment. We're seeing the members that are continuously enrolling as there is now a greater opportunity for affordable healthcare. And of course, as we mentioned earlier, our Supreme Court decision, where the ACA was once again upheld, and we will continue to move forward. Now, just looking at the numbers here briefly, we see that, of course, right in the beginning of the ACA, we saw a major spike in that membership growth up to about 12 million enrollees. You can see the highest number was just under 13 million in 2016. And since President Trump was elected, we saw a steady decline year over year, nothing significant, but there was absolutely some attrition over the past several years. And then now, of course, we're seeing that uptick once again with the American Rescue Plan Act and some of the other efforts from the Biden administration. So you could really see where the trend is going. And there's no data out there that tells us that this trend is going to stop and that we're not going to see continued growth in the ACA marketplace as these plans are becoming more accessible and there's additional plans that are entering the market. And when you look at the subsidies, of course, there were about 1.4 million new subsidy eligible members as a result of the American Rescue Plan Act. So because of that alone, there are members that are going out and getting affordable coverage. And what we noticed as well, and some of you may be able to relate to this as a safety net plan, is that there was absolutely a surge in membership where members were going out and revising their plans and re-enrolling into a subsidized plan if they now qualified. So under the special enrollment period and working with plans across the country, we absolutely saw an uptick in enrollments for members that were previously unsubsidized or minorly subsidized into more of a fully subsidized or almost fully subsidized plan. So we're continuing to see that trend. And when we look at the state-based exchanges, so of course the federally facilitated marketplace, the individuals had to go out and actively update their coverage in order to get that updated subsidy. However, some of the state-based exchanges had actually proactively re-enrolled those members into the subsidized plans. I know that working with Washington in particular, we pretty much went through a full renewal once again with their membership to get them enrolled in their updated subsidies. So really putting the member first and the individual first to make sure that they're getting the greatest benefit possible with their ACA plan. So at this point, we've talked about where we were and the positivity in the ACA, some of the challenges that had come up, and now we're looking at, well, this is a great opportunity for increased growth. Now, when you talk about that, of course, there's going to be additional challenges. And I'm sure many of you that are out there can relate to some of these new challenges that are being introduced with some of the changes as part of the Affordable Care Act and some of the things that the Biden administration is doing. Number one, increased audits and regulatory changes. Well, what does this mean? We've been working with health plan partners that have actually exited the exchange for multiple years, and they are now getting audited back to 2017. So you can see that the Biden administration is now going back and re-inspecting some of the audits that had been done back in 2017 and 2018 and so forth. So we're seeing plans now having to go back into the archives and pull out certain reconciliation information from enrollment to financial data to policies and procedures that were in place. So there's quite a bit that's happening now where CMS is going back and doing some retro audits of the data under the Trump administration. You're also seeing things like broker disclosures. I don't know if those of you that are familiar, but going forward, plans are going to be required to disclose that the brokers are getting paid a commission prior to a member submitting an enrollment. So that's a change that is coming down the pipe. Plans had just had to, this month, attest to their 2020 reconciliation. So plans had to attest that their entire reconciliation for their membership and their subsidies was reconciled for 2020, or that they've submitted the appropriate documentation to dispute those reconciling items. So you could see there is quite a bit of scrutiny on plans now as a result of this renewed commitment to make sure that this is done right and to make sure that all the I's are dotted and the T's are crossed. And with that, reconciliation. This is always a pain point for plans. And as many of you that are doing this for a while now, you realize that if your enrollment reconciliation is not reconciling, then your financial data is also going to be out of sync. And this could lead to millions of dollars in lost revenue opportunities from the plan. So we'll talk quite a bit about how reconciliation has becoming a bigger challenge, where issuers have to reconcile with the upstream entities such as CMS or StateBased Exchange, and then also their downstream partners, whether it be a claim system or whether it be other ancillary platforms that are being utilized as part of this overall ecosystem. So reconciliation is becoming more important as the days go on and becoming a larger challenge for plans. And with all of this opportunity, there are higher expectations and competition. In states where there were previously 2 plans in the marketplace, now we're seeing 5 and 6 plans, and that number just continues to grow. And as members become more aware of their healthcare and they become a more educated consumer, their expectations are increasing. They want this solution that they're being provided and this product that they're being provided to be able to be accessed via their mobile phones and their apps. They want to be able to make a payment in real time. Everything is going to this modernization now, and consumers are expecting this experience to be like when they're buying tickets for a flight or when they're doing their online banking. This is the expectation now that we have in healthcare. And this is a challenge for plans because they need to make sure that they're staying with the competition and even exceeding what the competition is offering as far as that digital experience is concerned. Now, what can we learn from banking? We saw this study from McKinsey, which we really found fascinating, that compares the banking to healthcare. And we had actually done the comparison with banking, but ultimately there's these 6 principles that McKinsey had introduced that how banks are able to get to this next generation modernization effort. Things such as focusing on integrations and moving your processing to the edge and moving to the cloud, and focus on configuration as opposed to doing full rebuilds. All of these principles we found directly correlated to what we're trying to do in healthcare. And following some of these principles will allow you as the health plan to be able to make sure that your plan is able to scale and able to succeed in this next wave of the Affordable Care Act. So we thought it was interesting that what McKinsey was looking at in banking, how applicable that was to what we're doing here in healthcare. And in just a moment, I'm going to share 3 principles with you all that we had taken from the original 6 from McKinsey that we're applying to healthcare, and things that you all can be considering as you're looking at how you're currently doing business in the marketplace, or how you can consider doing this in the future, getting into the ACA Marketplace. And what are those 3 principles? Well, number 1, integrators, connectors, and adapters. Oh my, not to be confused with, lions and tigers and bears from the Wizard of Oz. But this first principle is really focused around moving processing to the edge and not going through a full rebuild every time a new requirement is introduced or every time that you enter into a new market. This concept is using partners that have already done this before, where you could tap into their systems and they can fit into your existing ecosystem as opposed to a full rip and replace. And really, the more that you have these integrators, connectors, and adapters in place, the better chance that your existing solution is going to be able to connect with some of these other areas that you're looking to get into, whether that be the ACA Marketplace or Medicare Advantage, or even something like ICHRA. These are the things that you should be considering. Now, directly related to that, we look at this concept of modularity and modular designs. And at Softheon, this is something that we preach over and over and over again, and it's part of our secret sauce, is that everything that we're doing is built as an individual module. And those modules started out as a handful, and then it goes up to 10 and 50 and 100. And all of these modules are serving a very specific defined purpose. And that purpose can be modified through configuration. So as opposed to building this once and saying this is going to be what it does forever, you build these modules that can be strung together to ultimately create solutions that can be configured to solve business problems. And we'll give a few examples of that in just a second and some use cases on how we're looking at that today at Softheon. And then our third principle is moving everything to the cloud, this whole XaaS, or everything as a service concept. Just imagine for a brief moment what things would have been like had you had your on-prem installation during the pandemic. And many of you may have had to deal with this. You're in the process of moving your workforce to a digital environment, making sure that you could deploy your resources to work from home. How about going through an implementation during a pandemic, whereby you had to have individuals physically installing hardware and software into a database? It would have been incredibly challenging. And for those of you that may have had to go through that, I certainly feel for you. Now, when we talk about this concept of everything as a service, there are individuals and there are organizations that have done this before. And you can argue that the cloud is more secure now than these on-prem installations. So what we are suggesting in this principle is to move everything to the cloud, focus on software and different subscription modules that you can utilize to serve the purpose that you're looking for, as opposed to doing it yourself or building it as an on-prem installation. So this is the final principle that we suggest to be considered as you're looking at your overall ecosystem. Now, while these three principles are all interrelated, they don't all need to be implemented at once. These could be incremental changes over time that you could start to introduce that will have a great return on investment in the long run. So what we ask you to do is just consider each of these separately. Are you focusing on your integration points right now? Are you continuing to build up on your existing core offering? Are you looking at moving something to the cloud that may be an on-prem installation now that's going to help you in the future to continue to scale and to grow infinitely without having additional hardware expenses? These are just some of the things that we should be considering. And where we'll transition next is to show you a few applicable use cases where you can consider these types of principles. And number one here, the integrators, connectors, and adapters. So this is one use case from Softheon that we wanted to share. And this concept of integrators and moving the processing up to the edge, one of our health plan partners had mentioned that their effectuation rate increased by 11% as a result of increasing their merchant processing and moving that to the cloud. So engaging with the member more upfront and being able to collect that payment immediately as opposed to waiting for downstream systems to trigger. So this is one use case where the cloud solution was able to increase effectuations directly. And what we're displaying here is really, you have your core payer system that's represented. And by partnering with an integrator, you're able to not only connect with the federal marketplace, but there may be private exchanges that you're looking to connect with. There may be state exchanges that you look to connect with. Are there integrators out there that have already integrated with a state that you're looking to get into? And I know we're using a Softheon use case here, but really this is applicable anywhere. do you have those integration points that are built in that will be able to fit into your overall ecosystem, whether it's connecting with the federal government, whether it's connecting with public exchanges, your downstream systems, your pharmacy platforms, whatever the case may be, make sure that you have that ability to take your existing offering and connect that into these multiple different solutions and lines of business that are out there. Now, when you have those integrations established, we talk about this concept of modularity. And I hope that this slide here resonates with many of you all, whereby you continue to add these lines of business. You may be focused mainly in Medicaid today, but now you're looking to get into the commercial group market or into Marketplace. And what we found working with different health plans is that these systems are continuing to grow. So your core enrollment platform may have originally served as a Medicaid solution, processing Medicaid eligible members. And now you're trying to add on to that existing core platform, something like a Medicare Advantage or a Marketplace plan or a commercial group plan. And so you'll see that, and the fonts are intentionally varying here to show just the level of complexity in each of these areas in your potential core enrollment platform. And that core enrollment platform is connecting with your core finance platform. And within that core finance platform, that continues to grow and it continues to evolve and bubble up over time. So now you have your standard core enrollment platform that continues to get bigger and bigger and bigger. You have your core finance platform that's also continuing to grow, and they're trying to communicate with one another. And in the end, you still have one consumer that you're trying to serve. So whether you're generating a Medicare Advantage invoice, or you're generating a Marketplace invoice, or you're paying a claim for Marketplace, you're paying a claim for Medicaid, these core platforms are very disparate right now, and they continue to grow over time. So the alternative universe here is to move the processing up to the edge. So you could see that this is a much cleaner representation. And what we're trying to demonstrate here is that there may be many different sources where this data may enter into your ecosystem and how you're having to serve these members. But what we're suggesting is take those rules for Marketplace and for Medicaid and for Medicare Advantage, move that closer to the source, create separate modules to do the actual processing of those different lines of business, whether that's with a partner or it's something that you're building through your IT group. The point of this is, as you move that to the edge, you can continue to keep your core platform intact, so that if you're doing an enrollment, you're able to do an enrollment that doesn't have to worry about all the unique rules of Marketplace and Medicaid and Medicare. Or if you're doing a billing scenario, you're able to do that billing, but after all of the rules have already processed further upstream and closer to the edge. Again, finally serving that one individual consumer. So what we're proposing here is a universe in which you're able to take that processing, you're able to move it closer to the source while keeping your core platform intact. And that core platform, including your enrollment processing, your claims processing, all of your financial reporting and reconciliation, while moving everything else outside of that. This world in which both systems continue to grow and grow and grow and grow, they become no longer manageable and they're not able to scale over time. And we're seeing that working with many Medicaid plans that are trying to get into the Marketplace. It's often a challenge to try to retrofit some of these Marketplace rules into their core enrollment platforms. So that's some of the things that we discuss with our plans as they're contemplating some of these challenges. Now, this is just one very small use case and representation, but when you take it back a step and you get to an even more granular level, we talk about this concept of composability. And you'll hear this term from Gartner time and time again. And basically, you're taking these products and modules and services that you've created, and you're stringing them together to create a composable solution. And what we have represented here is a Marketplace enrollment, from somebody going through their shopping experience all the way down through getting that data into your data warehouse so that you can run all of your analytics reporting. So what this is intended to demonstrate is that this is, one, very complicated, and two, if you're able to build out these different modules and have them do a specific purpose, whether it's a marketplace enrollment processing or whether it's a Medicaid claims processing, you can continue to take these modules that you've built and you could string them together in different alignments to create these solutions. And that's sort of the beauty of what's presented here. Perhaps you replace step 9, instead of marketplace pre-enrollment, you change that to Medicaid pre-enrollment, but all the other steps remain intact. So this concept of modularity is whether you're building something in-house or you're outsourcing it to a vendor partner, this is how you should be looking at it. Look at these in individual modules that can come together to serve that purpose to meet your marketplace expectations or your Medicaid expectations. It really applies in each of these different areas. And what we're trying to present here is that this doesn't have to continue to bubble up and get bigger and bigger and bigger. There's a way that you can break this down into smaller pieces to create those composable solutions. And as you're doing this, really the only way for that to scale is to move everything to the cloud. I know we've been talking about this cloud concept for many, many years now, but it's really starting to materialize. And we thought that this graphic from Gartner really did justice to what it is that we're talking about here, in that you can see the traditional on-prem installation and then slowly but surely migrating those pieces to the cloud, starting with co-location and hosting platforms, and then looking at infrastructure as a service, platform as a service, software as a service, and then you can even go to business process as a service as well. So ultimately, consider utilizing the cloud and subscriptions that will give you just what you need in order to serve that specific function, as opposed to continuing to add hardware to the solution. And when we talk about scalability, the only real way to scale in some of these on-prem instances is continue to add hardware. Now it's a simple change for a cloud software provider to be able to infinitely scale, so that when you go from a 1,000 member plan to a 1 million member plan, you're able to meet and exceed that expectation. So the suggestion here is, again, consider the cloud, consider moving everything to the cloud. And this is really where all of these industries are going, just as we talked about in banking previously in that McKinsey study. So this is something to consider. And a brighter future. There's no other way at this point. We've gone through COVID over the past 15 or 16 months. We're starting to figure out what this post-COVID universe is going to look like. When will travel begin again? I know that we have our ACAP CEO Summit later this year. That's hopefully going to end up in person. And we really do see a brighter future ahead of us. There's so much opportunity in the ACA Marketplace. There's so much opportunity in healthcare to provide greater experiences for members. And when you think about it, all of the things and the principles that we just spoke about will lead to happier members. It will lead to reduced operational overhead and administrative burden. Costs will decrease because of the fact that you're doing things smarter than you have done before. You as the health plan are able to focus on your specific differentiators, as opposed to getting hung up on the next new requirement in the ACA Marketplace. You're able to focus on how to deliver the highest quality care to your members. And that's what's most important. And in working with health plans for as long as I have, I've realized that that is truly what they're after, is providing the best possible experience to their members, specifically the ACAP plans that I've interacted with over time. And using some of these principles, you're able to really create that best in breed solution that's able to scale to meet these upcoming demands that we're expecting in the marketplace. So when you consider those principles and the benefits associated, and it's not going to be an easy journey. If you start to take each one of these principles and start to integrate that into your organization, you'll be able to meet these increased regulatory compliance changes that are coming down. You'll be able to step up to the demand of your members, whether that be increased membership or whether that be just changing consumer behaviors and demands that they may have. And this presentation was timely as we had just done a study at Softheon and released a white paper, and you can see some of the publishing on LinkedIn that we had done. And of course, if you want a copy of this white paper, I'm happy to share it with you. Shoot me an email and I would be happy to provide you a copy. But in this white paper, we dig deeper into some of the concepts that we spoke about today. What are some of the challenges that health plans are facing? What are some of the opportunities and ways health plans can get ready for meeting that demand, either this upcoming open enrollment or the open enrollments of the future? So really look forward to distributing this white paper to everybody. It was written based on all of our experiences and other research that we've done. So we'd be happy to share some of our learnings with you all. And lastly, we have been partnering with our partners at the Healthcare Executive Group to set up this ACA Round Table. And for those of you that are on the line that may have attended the first couple, it was really well attended, and there was a great conversation around some of the topics that we spoke about here today in the ACA. So this webinar is a formal invitation to join us on Thursday, August 12th at 5 p.m. again with the Healthcare Executive Group and other healthcare leaders to discuss the ACA, to discuss some of these upcoming changes and really collaborate with your peers in order to keep moving forward. So with that, I really want to thank Heather and the ACAP team. I thought this was a lot of fun, and we are super excited about the ACA, and I know many of you are in the same boat. So Heather, I will pass it back to you.
Sure. Thank you, Kevin. This is great. Some really good topics here. And I do see a couple questions coming in, and just a reminder to everyone to please put your Q&A in the chat. First one that I did see, or actually put it in the Q&A button in your Zoom screen. The first one, just housekeeping, asking if the slide deck will be shared after the webinar. And yes, it will be. We do plan to. We did actually record this, and we will post the recording with all of that information up on the ACAP website. In the same, there should be a link to it in the email that you received for today. There is one question here that says on slide 7, your ACA enrollment from Kaiser is the on-exchange membership only. There's likely some off-exchange estimates as well driving ACA total enrollment, which is a great point. I don't think we have any exact estimates on what exactly those numbers look like. I've seen it often around 12 million once you add in the off-exchange, but it is harder to track that.
And then when you look at the ACA in general, I think the number was 31 million when you consider the Medicaid expansion and things like that. So the impact of the ACA, more generally speaking, has been significant. Exactly. There's a big difference there, for sure. So I guess a question for you, Kevin, is what are some of the biggest concerns that you hear by plans who are entering the marketplace for the first time? I think one of the biggest things, Heather, especially when you talk about Medicaid organizations, is this concept of retroactivity and all of the impacts to billing and financial data. It's not something that you deal with as much on the Medicaid side. So now when you introduce this concept of a household and dealing with retroactivity, that's one of the main concerns that we hear time and time again from plans is, how do we do this? How do we manage the retroactive changes that occur? How do we end up generating an updated invoice to go out to a member and make sure that we're collecting the right premium amounts and then ultimately booking our revenue? So that is the biggest thing that comes up time and time again, is this concept of retroactivity, and we're seeing it all the time in the ACA. We're seeing pretty much any time that you hit the keyboard in your application, there's another change transaction that's coming out, and that's something that plans really need to prepare for. And I'd add that on top of that is there's a lot of unknowns when you get into the marketplace around what are the requirements, what do I need to do as a plan? So one of the things that we do with our health plan partners is we take away a lot of that burden of driving the actual marketplace requirements as it relates to the enrollment and billing, where they can focus on how they're administering the claim. So I think the two biggest things is retroactivity and what are the things that I don't know about as I'm getting into the marketplace and some of those technical requirements.
Yeah, that's great. So what, speaking of sort of the expanding that we're seeing and the increase in enrollment numbers in particular, we've seen a lot since the ARPA, subsidies have increased, but what sort of strategies do you see plans implementing around expanding membership?
So I think there's a few things, Heather. Number one is getting into different states. There's plans that are starting out in one state with plans to continue to grow into others. And of course, that raises other challenges about, is that a state-based marketplace? Is that a federally facilitated marketplace? And these are considerations that plans need to have. But ultimately, we're seeing plans consider getting into other states and markets. Of course, they're competing on price. So plans are consistently trying to drive down premiums so that they're able to be more attractive, especially when you look at healthcare.gov, that when you're the highest priced plan, you may have to get through 5 pages of plans before yours is showing. So of course, competing on price, we're seeing plans expand into other markets. And I'd say lastly is really focusing on your distribution channels. So focusing on how many different places can I have my plans out there. You could think of the concept of, if you want to get a flight through Delta, you can go to delta.com and just see those plans, or you can go on to Kayak or some of these other sites. You want to try to get your plans on as many of these platforms, whether it be private exchanges or otherwise, where these plans are able to be shown. So I think focusing on the distribution channels and leveraging things like ICHRA. I know we didn't speak about it too much here. We've done some other prior webinars on the concept, but embracing these members that are in group sponsored coverage right now that may end up going into the individual market with that defined contribution from their employer. So these are just some of the things that our plans are considering.
Yeah, that's excuse me, a great point, especially around the defined contribution from the employer. I do think that we may see more and more employers starting to move to an HRA model or adding. So I do think that's something that's particularly important for plans to be aware of.
For sure.
One thing that you mentioned there that I'd like to flesh out a little bit more is around federally facilitated marketplaces and state-based marketplaces. And certainly we've seen a couple states move recently from the FFM to an SBM. Do you think this is a trend that we're likely to see continue?
We do. And this had really started over the past several years with Pennsylvania and New Jersey, and then prior to that, Nevada going to a state-based exchange. So we're consistently seeing this trend from moving off of the federal exchange and getting into these state-based marketplaces. And of course, we're watching closely what's happening in Georgia, whereby they're looking at starting their own version of an exchange, and what are the impacts to enhanced direct enrollment and being able to utilize that. Because right now, for those of you that are familiar with enhanced direct enrollment, it's only available on the federal exchange. So anyone who is trying to enroll into a subsidy through your own white labeled platform, you would have to be in the federally facilitated marketplace. But Georgia may be the first state that's moving in the direction of allowing the plans to do an enhanced direct enrollment type concept. And we're going to really keep a close eye on that, because that may be something that we see as a trend going forward.
Yeah, and I think it's smart to watch what happens in Georgia. I expect that there will be some fairly significant changes from how their sort of new proposals around EDE are rolling out to or how they have intended to roll it out to how they do roll it out. I would not be surprised if we see some updates from CMS. Of course, Georgia had that provision where basically they would eliminate having any sort of centralized
Mhm.
SBM or FFM.
Yep.
I suspect that we will continue to see a lot of, legal discussion and challenges around that, as well as, potential changes from around the 1332 waivers from this administration. So I think that is something to watch closely.
Absolutely.
I just saw another question pop up here. So it says brokers used to make up the bulk of distribution pre-ACA. Many thought independent brokers would have no role whatsoever in the ACA exchange business, but they make up about 30 to 40% of enrollment. What do you see going forward as the role of independent brokers? Are they becoming more online? Do they need to become more online savvy in order to become successful, et cetera?
Well, I think brokers are always going to be a factor in the equation. And, we've seen varying participation for brokers based on the different state, based on the individual plan. But one thing that we're seeing more and more are of these web-based entities, which are serving as a broker to help guide some of the consumers through the process. So as the consumer gets more educated as far as how to navigate their healthcare, we may see that decrease a little bit, but there's always going to be broker engagement that's involved. And it really will depend on the specific geographical area, because there are still individuals out there that require some assistance. This thing is still very, very complicated. So we do expect that brokers are still going to play a main role depending on the certain states and regions. And I think it's going to be interesting how plans tackle this broker disclosure requirement. And Heather, I'm not sure how you all are tracking to that, but watching that very closely to see what the level of disclosure is that's required out to these members in advance of enrolling, and if that will end up moving people away from brokers, or how plans will sort of try to introduce that to not detract members from enrolling. So I think that's going to be something we want to keep a really close eye on and see how that could potentially impact the broker's role. But I really don't see it going away whatsoever. I really think that they're still going to play a critical role in this ecosystem.
Yeah, I think that makes a lot of sense. And I agree. I don't think brokers are going anywhere. I think what'll be interesting to watch is some of that disclosure information, and to what extent there are more maybe regulations put in place on brokers. Certainly, we've heard and seen anecdotes of brokers who are not always acting in the best interest of the consumer. There's talk on Capitol Hill about, maybe a fiduciary requirement for brokers, things like that. So, maybe there's some more opportunity for change in how brokers are used, and but it may well change.
And one thing to add to that, Heather, is I think it's important for plans to consider the experience they're providing to their brokers as well, because brokers really want to make sure that the process is as simple as possible to serve their members. So it's really important to consider what that solution is that's being provided to these brokers so that they can help the individuals to navigate not just their initial enrollment, but some of their ongoing transactions as well. So I think that's a really important consideration for plans as they look to onboard brokers, and they want brokers to engage with their health plan specifically.
Yeah, that's great. So here's another sort of question around advice for plans that came in, which is that many exchange consumers, may be new to healthcare and choosing insurance, and really struggle to make sense of all of the complexity that's out there. And for a new issuer that's considering entering the marketplace, what advice would you give around plan construction? Having multiple different product offerings versus having fewer plans for simplicity, et cetera.
So I'm going to share my own. I'm going to start off by saying I am not an expert in plan construction. That is not my area of expertise. But what I will say is that really less is more. When it comes to navigating as a consumer within a specific health plan, of course, when you're going out into the marketplace, you want to see as many plans as possible with varying benefits and things like that. But when it comes to an individual plan, my statement is less is more, in that the less options that there are, the more likely it is that they can digest it as a consumer. But that is very much, I'm not the expert in that area, but that would be, my personal interaction with plans that are getting into the marketplace.
Yeah.
I don't know, Heather, if you have anything to add to that
I
one.
think that's smart. And I think, we've really seen in states that had standardized plan options, those were very well appreciated and were very attractive to consumers. And there's certainly been sort of talk and push around moving back towards having more of those simpler standardized options and having fewer choices so that it is less complex. So I think that's right in line with that.
As somebody who's, tried to navigate my own personal healthcare, it is still very, very confusing, very difficult. And I live and breathe it every single day. So, and I would say that I'm not the minority in that. I would say there's probably many others out there that are also very confused about what their options are.
It's very true. And I just recently was helping a friend who was transitioning off of, family insurance, off of her husband's plan to find one in the exchange from an employer plan. And it's very complex. And, it was every 10 minutes she'd call and say, wait, but what does this mean? And what does this mean? And so I think that's, a very emblematic of the experience that most see. And the simpler and more straightforward you can be, the better.
Yep.
Yeah. So I'll ask, we'll see if any last questions. That's all the questions in the chat. I'm going to ask one more sort of moderator prerogative here, which is if you could give one bit of advice to plans as far as, what services they should work, what they should do in-house versus what makes sense to contract out, what would it be?
I think the processing that happens in-house is focused around delivering care and connecting your members with as many potential opportunities to be more proactive about their health insurance and to try to build, healthier outcomes. So I think that, plans should really be focused around serving their members and less focused on how do I meet all of the demanding requirements of the ACA and Medicaid and Medicare Advantage. So if there's one thing to build versus buy, I would focus on, how am I serving my members directly? How am I interacting? What type of engagement do I have with my members, as opposed to how do I meet all of these, very difficult healthcare specific requirements? That would be my bit of guidance. And still following those principles that we talked about earlier, whether you decide to build it or you decide to buy it or you decide to partner with somebody else. I think it's really important that no matter which route you go, to keep in mind some of those principles to be able to scale and to be able to thrive in this environment.
That's great. Thank you. Any last questions? Okay. If not, I think that is it for today. So thank you so much, Kevin. That was truly excellent. I'm always impressed by your and Softheon's knowledge on everything related to the ACA marketplace space. So thank you for that and for being such a valuable partner.
Great. Thank you, Heather. Thank you, everybody, for joining. Really appreciate it.
Thank you, everyone. Take care.
All right. Bye-bye.
Bye.